Welcome back to QuickNurse. Today, we are mastering the most essential nursing skill, manual blood pressure. If you struggle to hear the thump or get confused about when to read the numbers, you are not alone. In this video, we will visualize exactly what is happening inside the artery, so you never miss a reading again. First, let's understand the theory. We are listening to the brachial artery. Normally, blood flows smoothly, so it makes no sound. When we inflate the cuff, we squeeze the artery shut. The blood flow stops completely. As we slowly let air out, the artery opens just a tiny bit. The blood rushes through turbulently. This first thump you hear, that is your systolic pressure. As the cuff loosens further, the artery fully opens. The flow becomes smooth and silent again. The exact moment the sound stops is your diastolic pressure. Now let's get ready. You need a stethoscope, a sphygmomanometer, also known as a BP cuff, and alcohol wipes to clean your earpieces. Patient position is key. The patient's feet must be flat on the floor, their back supported, and their arm resting at heart level. No crossed legs and absolutely no talking, or your reading will be inaccurate. Let's begin the procedure step by step. Step 1. Palpate the brachial artery. It is usually found on the inner side of the elbow crease. Step 2. Wrap the cuff snugly around the upper arm. Make sure the artery marker arrow is lined up directly over the spot you just palpated. Step 3. Put your stethoscope on. Ensure the earpieces are facing forward, towards your nose. Place the diaphragm gently over the artery. Step 4. Inflate the cuff until the gauge reads about 30 points higher than their expected pressure, usually around 160 to 180 millimeters of mercury. Step 5. Deflate slowly. This is the secret. Aim for the needle to drop just 2 to 3 lines per second. Listen closely. The first clear tapping sound you hear is the systolic number. Note it mentally. Continue listening. The sounds will get muffled, then disappear completely. The moment it goes silent is the diastolic number. Finally, deflate the cuff fully and document your finding. For example, BP is 120/80. If this visualization helped you, please hit like and subscribe to QuickNurse. Comment below what skill you want to see next.